So if it's in the first trimester, I think termination of the pregnancy should be considered because this is often, as you say, an urgent situation. So we need to treat immediately often. So if it's in the first trimester, it's very difficult. And often acute leukemia is often not diagnosed based on the NIP test, but because of the patient has complaints. So for lymphoma, it's often diagnosed with the NIP test, which is at the stage of the start of the second trimester. For acute leukemia, if it's in the first trimester, termination of pregnancy is often recommended. From the second trimester on, we can give the classical chemotherapy, not the new targeted therapy, which is not considered safe in those patients, but we can give the classical most of the classical chemotherapy, but we have to be careful that acute leukemia is associated with some coagulation disorders. So first you need to correct those coagulation disorders. Whether you go to chemotherapy or whether you go to termination of pregnancy, you really need to correct those coagulation problems, because otherwise it can lead to fatal bleeding disorders, for example, in the mother. And then you can give the chemotherapy, but we have to be careful because chemotherapy causes an increase of red blood cells, white blood cells, platelets. And this is a situation in which you are not going to perform a delivery. So we really need to collaborate with the gynecologist to be sure that the timing of delivery is outside of that window of chemotherapy. So, for example, if the diagnosis is at 33 weeks, we will probably first go to delivery and then give the chemotherapy. If the diagnosis is at 24 weeks, we can give the chemotherapy, which lasts for 4 or 5 weeks, and then we have to see if we can give a second course or if we have to go to the delivery of the pregnant woman.